welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. Gentlemen, if the thought of having a vasectomy scares you to death, this is the podcast for you. Today, we're talking about a no needle, no scalpel vasectomy, a procedure with less pain and a faster recovery. WVU Medicine Urologist Dr. Zachary Werner is here to explain everything you need to know about this minimally invasive procedure and explain other vasectomy options, including vasectomy reversal. Welcome, Dr. Werner, to Live Healthy West Virginia.
Thank you very much for taking the time to bring me onto the show.
Okay, great. We got a lot of good stuff to cover today.
Oh, yeah.
All right, so here we go. Let's start with the basics. How does the traditional, for lack of a better word, traditional vasectomy procedure work? What can a man expect?
So traditionally, they would make an incision in the scrotum. They would grab the vas deferens, which is the tube that transports the sperm, bring it up, cut out a significant chunk of that piping, and then usually tie off either end and then drop everything back down in. And that would be the typical way that you would do a scalpel or an invasive vasectomy in the past.
Okay. And I imagine, do you have a lot of patients that are hesitant about going through this procedure? I think there's a lot of fear.
It's a sensitive area.
Yeah.
So,
I see what you did there.
Yeah. So there is definitely some hesitation. One of the most important things is to know that it is the most effective form of contraception. It's actually even more effective than tubal ligations.
Really?
So anything short of a hysterectomy, it's pretty good.
Yeah.
And most of the time you don't have to go under anesthesia unless there's significant anxiety. When I do the physical exam, I always tell them this is going to be a little bit of a dry run for what they can expect during the procedure.
Okay.
Or if I have difficulty palpating, kind of that
palpating.
Oh, I'm sorry. Feeling that tube.
Okay.
If I have trouble feeling that tube, it's going to make the surgery a little bit more difficult. And so in those cases, I will put people under some light sedation, but most of the time, I can feel everything just fine.
You're awake.
Oh, you're awake.
Oh, okay.
We have a good time. I let you pick the music.
Oh, do you? All right.
I do, of course.
That's awesome.
Anything that makes someone more comfortable when they are in there.
Sure. Yeah.
It's a conversation just like this. I've got my loaded set of questions.
Yeah. It's distraction, right?
Oh, yeah.
That's great. So how does a no needle, no scalpel vasectomy procedure work? Is this like a robotic procedure or?
So you're back in our clinic, right across the street here, and you walk in as if you would be at a normal appointment.
Okay.
If you're significantly nervous beforehand, as we talked about, then sometimes I'll give people just a relaxant. If you take that, you can't drive. You got to have somebody come bring you.
Okay.
But basically, it's just the patient and I in the room, the patient and me in the room, along with a nurse. And I get started by talking through everything, talking about the procedure, making sure everything's still okay. I use a device called the ModaJet, which is this fancy little device where I put the lidocaine, which is kind of the anesthetic. It's what you use at the dentist office.
Yeah.
So you don't feel the pain. I put it in this spring-loaded device, and it pressurizes the lidocaine so that when I grab the tube, I press a button, it shoots the medicine into the skin. It feels like a slight twinge, a little pop, and that skin is numbed up. And then after that, it proceeds like a normal, minimally invasive vasectomy. So you don't feel any of the needles going in.
So you don't feel a needle or anything. It's just like spraying a numbing spray on it.
That's correct.
Okay. Well, that doesn't sound too bad,
Most of the time, it's tolerated very well. So even if you do not use the no needle technique, you use a very small needle, and you'll numb up. I usually tell people that is the sting.
Okay.
And then I numb up that tube, the vas deferens. That's the kick.
Okay.
And then I bring out the vas deferens, which I tell guys that is kind of that feeling you get in your stomach when you have just taken the kick, and that briefly goes away. And at that point, they shouldn't be feeling anything pokey is what I say.
Okay. So how long would this procedure last?
It takes about 20, 25 minutes.
Oh, that's not bad.
It's
That's
not too bad.
And it's outpatient.
Absolutely, it's outpatient. Right, so I do them on Fridays, and then we have another physician, Dr. Elisa Day, who also does them on Fridays. So the goal is, I tell you, just relax, take the weekend. You know, you don't mow, watch TV.
Yeah.
Not in charge of the kids.
Good excuse to now. And you said that if you don't, take something to relax.
Sure.
Or if you do take something to relax, you have to have someone drive you. But if you don't, can you just drive yourself home after?
Of course.
Really?
Yep.
I thought that it would be much more involved for recovery. See, I don't know a lot about this.
Oh, no, you come in, we make sure that you're still good to go with everything. We do the procedure, and there are 2 ways that I will often test afterwards. One is you bring your sample, which is basically a post-vasectomy semen analysis.
Okay.
You either bring it to a WVU lab, and they will see if there are any sperm that are able to basically conceive. Or there's actually a mail-in kit, which we offer now, which is a little bit more expensive, but you basically FedEx it out, and they will email you the results, and so you don't have to come into the lab if you don't want to.
Oh, they're doing that with everything now,
It's pretty convenient.
Yeah, kind of like DoorDash, but,
Just not around the holidays. FedEx won't ship it out.
Okay. Well, that's good to know, too. So what are the advantages of having a no needle, no scalpel procedure as opposed to the traditional procedure?
So the risk of what's called a hematoma, which is a big blood clot forming in your scrotum, is significantly less.
Okay.
The risk of post-vasectomy pain syndrome, which is a known risk after you get a vasectomy, that's a feeling guys would know, kind of like you got flicked down there.
Okay.
That is less common. The method that we use now, this minimally invasive vasectomy technique.
Yeah.
So instead of being several percentage points of the time, it's more like 1 or 2 percentage points. There was a big study out of Barcelona the other day where actually it was only about 1 percentage point with the same method that we do here.
Oh, wow.
So less likely to get that what's called post-vasectomy pain syndrome, which is typically self-limited, and less likely to have a significant, we consider a complication, that big blood clot.
So is this becoming a more common procedure? Do you do more of the no needle, no scalpels than the traditional?
So the traditional is very rarely offered anymore because the complication rates have been lessened by essentially use glorified needle nose pliers.
Yeah.
And you make a tiny opening in the skin, and then you do your work through that opening. And actually, I don't have any stitches. I just cauterize that area closed and put a little surgical saran wrap on there. And
so you don't have to wait for stitches to dissolve
nope,
or anything
there's no,
like that.
You take a couple days, take it easy, and it's kind of like a blister.
Okay. All right. This is definitely not your father's vasectomy or grandfather's.
No, it should be easy.
Yeah.
Sometimes you have some harder cases, which is what I always talk to patients about. When it's a procedure, it's easy for me to spit out a bunch of numbers, but it's always your procedure when you're getting it done.
Right. And is this something for everybody? I mean, who's a good candidate for this? I mean, who would bother with the traditional?
Actually, it's a wide array of patients. It used to be that urologists would not perform a vasectomy on patients that don't have any kids. That's no longer the case. There have been studies where they look at regret for childless patients, and it's not significantly higher. So the vast majority of patients have had a few kids, but that's not to say that I don't see younger men who have decided that they don't want to have any children, and I counsel them. I talk to them very heavily about what it means, talk to them about vasectomy reversals, talk to them about how they still produce sperm. Even after the procedure. It's more like blocking plumbing, and if they are still okay with it, then we go through with it.
And I read, is it true that once you have the vasectomy, it's not like effective immediately?
Oh, absolutely, it is not effective.
Okay,
immediately.
because
You
that's
still got everything downstream.
Okay, because that's still important to make here. So how long does it take to be in the safe zone?
So you are in the safe zone once you have completed the necessary testing. Okay, so you want to at least give it 8 weeks.
Okay.
So you'll be using protection or contraception for 8 weeks. That allows most of the sperm to basically die. And we say 15 to 20 ejaculations at least, which clears out the piping.
Okay.
So then we'll do that semen analysis test. Earliest would be 8 weeks. I typically do 10 to 12 weeks.
Just to be sure.
Just to be sure.
Want to err on the side of caution.
And then once you get that test, it'll say there are sperm, there aren't sperm. Ideally, there are no sperm. We also consider success if there are very low amounts of non-moving sperm, which basically means that there is still some dead sperm probably left over.
Okay.
And so the likelihood of that resulting in conception is very, very low. If there is something still there, which can happen very rarely, then we do a repeat semen analysis in another 4 weeks, and most of the time it'll scar down.
Okay. Because you were talking earlier about how effective it is.
Mm-hmm.
What is it 100% effective, 95% effective?
So the likelihood of failure in the first 3 months basically will be considered like an early failure of the two ends growing back together. It's been quoted about, depending on the method you use, around 1 in 500. So not zero, but pretty low.
But that's low.
And then if you have a good test and you're given the good to go, 1 in 2,000 that you will have the two ends grow back together later in life.
Those are very good odds. That's good to know. And how long is the recovery typically with this procedure?
I tell patients, you'll be able to walk immediately. The classic frozen peas, do it. It wraps around. It's good.
Yeah, okay.
Tylenol and Motrin is all you need.
That's it.
That's it. Tylenol and Motrin, and ice it over the weekend, 20 minutes off and on. I tell people wear something high and tight.
Okay, that makes sense.
Mm-hmm. And by Monday, most people are able to go back to doing what I'd say is light duty. I wouldn't go for a marathon.
Right.
But you're typically good to go back to most work.
Most work, depending on what you do.
Mm-hmm.
Wow. That's a big change, isn't it, from the traditional one? I mean,
in the past, they'd put you to sleep. So it's much less common. People still do ask, they hear a horror story.
Yeah.
And I talk to them about it. Talk to them about if they really are that nervous. I won't refuse.
Yeah.
However, it's preferred, given how standardized it is now, to do it under local.
Okay.
With just the lidocaine, I should say.
Okay. Is the no needle, no scalpel procedure covered by insurance? Usually?
It is.
Okay.
Yes.
That's important to know.
I checked
too.
right before I came here. I asked our scheduler. I said, have you had a lot of rejection? She said no.
Okay, that's good to know too. All right. So you were talking a little bit about, counseling people. What happens if you do change your mind?
So first of all, that happens.
I bet it happens
Life
a
happens.
lot. Yeah. Does it happen a lot, or?
It's around 2% of all vasectomies, so not a ton. That is people who want vasectomy reversal, though.
Yeah,
now,
that's what I'm talking about.
So you still produce sperm. So you could have a reversal, which is reconnecting everything, and we can talk about, what does success mean there, words like patency and pregnancy, which I'll explain.
Okay.
But another option, which I tell especially couples who are a little older, who can have issues with fertility naturally in general, and especially people who might only want one child, that I can put a needle into the testicle and basically pull back on a syringe and pull some tissue out. I do it right over at the Center for Reproductive Medicine, and they will take that, freeze it, and use it for what's called in vitro fertilization, which is when you put the sperm and the egg together in the lab and at the right time of the month, transfer it on over.
Yeah. Wow. Okay. So that's an option.
That is an option.
That's an option. That's an expensive option, isn't it?
It is. It's very expensive.
And insurance sometimes covers it, sometimes not, right?
Yes. Most of the time, not. Most of the time, it is a significant out-of-pocket cost, although various insurances can offer some partial coverages.
Yeah. Yeah. Okay. So let's say you do change your mind.
Sure.
You don't have the kind of money to go with the option we just talked about, in vitro fertilization, can a vasectomy be reversed? No needle, no scalpel?
The process is a little bit more involved.
I had the feeling.
So
I had to ask.
They'll be asleep.
Yeah.
We use an operating microscope. So that means that there's this big contraption that we bring into the operating room, and I literally look through the microscope,
Right.
and I suture the two ends back together using really, really small needles.
Okay.
And I cut the one end that was blocked,
Okay.
okay, and I squeeze it, and I see what comes out. I look under the microscope, and I'm looking for, are there any sperm? Are there pieces of sperm? Are there sperm that are swimming? And depending on what I see, I'll either put the vas deferens back to the vas deferens, so similar tubes to tubes, so similar piping.
Okay.
Or I'll have to go what I say is further upstream to what's called the epididymis.
Yeah.
This is it's like a sperm reservoir. It sits on the back of the testicle like a backpack.
Oh, okay.
And those have way smaller tubes. So that's like, instead of hooking a river to a river, it's like trying to hook up a stream to a river.
Oh, wow. That sounds complicated.
They're pretty, it's involved.
I bet that's not a 20-minute procedure, huh?
That is not.
No. I didn't think so.
It takes a few hours. Usually I call halfway through to let, the partner know how everything is going.
Yeah, yeah.
Now, depending on how long it's been since the initial vasectomy, that will give an idea of the likelihood of having to do that more involved procedure.
Okay, okay.
And then what I see under the microscope can give us a little information on the likelihood of success. Now, success, for what most patient thinks, takes two to make a baby, right?
Right.
So for me, I'm trying to get sperm back into the ejaculate so that they can conceive naturally. Now, those rates are pretty significant, okay? So especially
Significant which way?
So
what do you mean?
I would say, if I'm able to see a full sperm when I look under the microscope, patency rates, which is return of sperm to the ejaculate.
Okay, you're going to talk to me at a lower level. Patency. What is a patency?
That would be if you do your semen analysis after we do the whole surgery and we see sperm.
Okay.
That is 85 to 90% or more.
89%?
85, 90% and up.
Okay.
Okay.
That's more than I thought. That sounds like pretty good odds, right?
They're pretty good. You have to wait a significant amount of time, the life cycle of sperm, to make it.
Right.
It takes about 3 months.
Yeah.
So I get a first semen analysis around 6 weeks. I want to see that there are any sperm. Then I get another one at 3 months. I want to see the numbers improve.
Okay. And so is it, if it's closer, is it more likely to work the sooner it is after the original vasectomy?
It is. You can imagine the scarring gets closer and closer to the testicle as time goes on.
Yeah.
So then you have to go again farther up towards those streams to hook the stream up to the river, which is what's called a vasoepididymostomy. So that one is the more involved one. The return of sperm to the ejaculate, or that patency rate we talked about, for that would be more like 65%.
Okay.
And people always say, well, they're not in this just for that. They want to have a child.
Right.
Pregnancy rates depend very heavily on the woman's age.
Yeah.
Okay. And they're typically around half of the patency rates if you give it a full year of somebody trying after the vasectomy reversal.
Okay. And obviously age of the partner, affects all of that as well. Wow. So so it sounds like an effectiveness rate. What would you call like the effectiveness rate of a vasectomy reversal?
The effectiveness rate comes with the caveats of how long it's been.
Right.
And
what's the range then? Let's put it that way.
The range of success, if you are able to, it should be higher than 65% if you had to do bilateral rivers to streams. If you can do both sides river to river, it should be 85 to 90% or up.
So it could be different on each side.
Of course, yes. So what I'll tell people, if one side is one of those procedures and the other one is the other, then you got to average them and take half of that if you want to look at your pregnancy rate.
Now we're doing math.
Oh, yeah. It helps with the drawings. It helps with the drawings.
Yeah, I'll bet. Is there an age limit on when you can receive a vasectomy reversal?
I do not have a strict age limit, but the thing to remember is the likelihood that you're going to have to do that more involved procedure is very high, certainly once you get over 10 years. Furthermore, there are tiny muscles that push the sperm through those streams and rivers. As you get older, those muscles, like all of your other muscles, they're not as strong.
Right.
So you could do a successful procedure and there's not much anything comes out.
Yeah.
Not only that, as you age, your normal sperm counts, your percent that move well, all of those numbers decrease. And so you won't return to a baseline, as well as having increased risks of schizophrenia, bipolar disorder. So as a man ages, the sperm carries an increased risk. So I counsel patients on all of these things.
Now, wait a minute. When you're saying the risk of bipolar disorder, are you talking about in
the offspring, in the child?
Really? Now, that's one I've never heard of.
It's called advanced paternal age. So when the dad is older.
Okay, so there's a higher risk of those kind of conditions.
Yes.
Wow. We're learning a lot here today.
There's a lot involved.
You are a fountain of information. Does insurance usually cover reversals?
The only insurance I know is actually the VA. They cover it. They cover it the vast majority of the time. That's where I did my fellowship part-time at the VA. Other than that, it's very rarely covered.
Is that an expensive procedure?
It is, although not necessarily in comparison to in vitro fertilization. It's about a third of the cost.
Okay.
And then if you're able to have multiple children, you'll be able to decrease that cost a little further.
Yeah. How long's the recovery for a reversal?
So
it's much more involved.
If I am able to do river to river, the incision, so the cut that I'll make, is actually only about 1 inch on either side. So the recovery is pretty quick.
Okay.
I would say it's like a more aggressive vasectomy, and you're pretty sore. But if I have to do that other procedure, I have to deliver the whole testicle. So the whole testicle has to come out of the scrotum.
Oh boy.
And that one, you're laid up longer. I tell people.
How much longer?
Definitely want to refrain from anything very strenuous for 2 weeks.
Okay.
After the first one, definitely 1 week. Some guys still it takes 2 weeks. After the other one, definitely 2 weeks.
Okay. Well, that's all good to know. So you do this over at the WVU Medicine Urology Department. Talk a little bit about the depth of experience of the WVU Medicine Urology team. I mean,
well, that's extraordinary.
It is.
So
don't be afraid to brag. Seriously.
So I can say, I don't think my mom would get mad, but I would say that my mom had urologic issues, and I actually brought her down here to WVU.
Nice.
And my friend's mom, my friend's dad, all of my friends.
That says a lot.
I think so.
To me, that's.
So when people say, would you, if I was your father, people would say,
Right.
if I was your mom, if I was your dad, where would you send me? Would it be okay? The answer is, yeah, I have already done that.
Yeah. That's great. That's good to know. I'm not surprised at all. So before we go, I'm going to ask you, this is a two-part question.
Okay.
What's the most important thing you want our viewers, listeners to know and remember about, well, we'll start with vasectomy reversal, and then the same thing you want them to know, the most important thing you want them to know about no needle, no scalpel vasectomy. Okay. You start with whichever one you want.
For vasectomy reversals, things happen. Life happens. You thought you were sure, and you change your mind. It's totally normal. Even if you just want some information to know about a vasectomy reversal versus IVF, I think it's worthwhile to at least know, because it can make a big difference in what you're going to do, because there are options.
Yeah.
For the no needle, no scalpel vasectomy, guys should know that it's really helpful when they think that they don't want to have any children and they're thinking, oh, maybe we'll get a tubal ligation, or my partner is not doing so well on the hormonal contraception. It is typically, I'd say, a 4 out of 10 for these guys. It's a poke and a burn and a kick and that stomach feeling, and I'm talking to you the whole time just like we are, and we make it through. So that's what I'd say.
Okay. Well, that's good to know. It's always good when you can make it easier on the women.
I think it is. You know, they'll have to go under anesthesia if they want to do, you know, a tubal ligation, which, if that is the way it's going to go, I appreciate that. You know, I think that it's a major step in the right direction for a couple to have those conversations.
Oh, sure.
But if the guy wants to take that step, we'll help him out. Yeah.
So there's nothing to be afraid of, really. I mean, I know it's easy for me to say, but I think people have a lot of misconceptions like I had about this procedure. It's totally different.
Come see us. Talk. We'll talk shop. At the end, if you don't want the vasectomy, that's okay. We at least talked about things.
Okay. That sounds great. Well, thank you so much for sharing this information. We spread a lot of new news.
Good.
Thank you.
Yeah, of course.
Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information on vasectomy and other urologic issues, visit wvumedicine.org/urology. To find the latest episode of Live Healthy West Virginia, follow us on our YouTube channel at youtube.com/WVU and click on the Live Healthy West Virginia playlist. Or search WVU Medicine to follow us on Spotify to find this podcast and all WVU Medicine podcasts. I'm Mary Ravazio Menard, and on behalf of Dr. Werner and everyone at WVU Medicine, thanks for joining us.